Hey, Dr. Metzl. Nice to meet you.
Anyways,
So, I guess we're having this conversation today because there's this pandemic thing that's happening.
I heard about that. Cardi B said something about it. The coronavirus is getting real or something. So,
There's, oh my goodness, there's such a situation. So, like, I think I'm so excited to meet you and have this conversation with you. And so, we got some cool questions to kind of prompt us along. So I'll read the first one, and then I think let's just wax poetic on it, right?
sounds good.
So, what does the world know now that you knew then? Like, what does the world know now that you knew before pandemic situation? Um,
Well, I think the main thing is that we have an incredibly unequal and unfair healthcare system,
mm-hmm,
and that access to all the things that you need to be healthy, maintain health, get help if you fall ill. Um, those were all things that were um, huge structural vulnerabilities in our system. A certain number of people had great health care, and other people had no health care. Some people had access to healthy food, and other people didn't. Some people had worker protections, and other people didn't. And so the whole framework around health, something that was leading to rising despair and unhappiness, and not just from Bernie Sanders supporters or something like that, but
mm-hmm,
people in the healthcare system thought it sucked also. And so this idea of just how hard it was to get something as basic as what should be a kind of universal human right,
mm-hmm,
treatment or health, and that's certainly been exposed. This pandemic has been a reflection of those inequities. So I would say the main thing is just these things that were, some people really knew this about our healthcare system, and other people had the privilege of not knowing them. And now it's just plain as day for everyone. So that would be number one.
mm-hmm,
Number two is that over the last couple of years, I studied public health. We had undermined our ability to address a pandemic. And so I have a lot of friends who work at the WHO who've been worried about something like this happening a long time. And there were countries that were preparing for the possibility that this might happen. And it was also kind of watching us undermine all the structures as a society that would have had us be ready for this much more prepared. So, those are the two
mm-hmm,
scary and tragic things I think that are really being exposed. I mean, I could also tell you that we had the wrong leadership team in place.
mm-hmm,
But
mm-hmm,
like that was a big surprise.
mm-hmm,
So I would say all those things that we had a lot of structural vulnerability that was not working for a lot of people.
mm-hmm. Yeah, I would agree. I think my artist nuance on that is that it would be the intention at which this happened, and the role of racism, power, privilege, and I love how my friend Dr. Brittany Cooper started this conversation around necropolitics, necropolitical culture the other day, because I think, having worked in healthcare, so, I'm a family doc and geriatrician, but also spent a lot of time in national and global labor. I felt like a lot of times people, even if people understood what the inequities were, they felt like they could make a business case for it or make a moral case for it or make if they just explained it the right way, even to all the deciders in the world, that we would have a better system. And, the thing that, especially me being in a Black body in Brooklyn, and being in a Black body my entire life, knew is that there are some folks that are just okay with me dying, and actually are fine with erasing people that look like me. And so, when you take I've actually had an opportunity to look back at when I traveled to Botswana in 2015, where we were convening, folks from around the continent to talk about what next, for public health infrastructure investment around this. It was we got to let people know that these political decisions, should it be in the wrong hands, this is life and death. So you see now, where if it were just economics, you would think that this, the current president of the US, who's completely all about himself and his money, would have turned that, pandemic panel into his buddies, who made millions of masks. And then on the other side of this was selling masks, and everybody would be, you know what I mean? You would have found a way to monetize this.
Yep.
Versus being okay with it unleashed in China and you know, the UK and Italy and in Black communities, and just letting the death. So death was the priority versus healing or even his money. You know what I mean? And so that kind of thing where it's like, you know, whether it's at the, you know, city level, you know, national level, global level, where you have to understand and confront that there are people in the society that are okay with folks dying and actually will set up the case for that. You know what I mean? What, you know, helps, you know, whether you're an activist or a policymaker or a politician, you know, think about how to move, you know, differently. Like, but you have to say and understand that it's, you know, anti-Blackness, that it's intentional, that it's not a moral case, you know? So,
No, I mean, intentional is, I mean, it's no mystery. You know, I think that the minute that these disparities started to show up, it's a moral choice at that point, right? You know, this is a national failing that is disproportionately affecting very clear communities in our country. And either that is a rallying cry, like, we do not stand for this because we are not all Americans. We are going to fix this problem right now in the middle of this horrible moment, or we're going to exacerbate it, right?
That's right.
Or states open up where communities of color are in the jobs that are probably going to be still the riskiest, you know? And so in a way, he missed two diagnoses, right? The first diagnosis was, you know, he had a 2-month lead time into the coronavirus and didn't prepare. But then when the disparities started to show up, here's a moment to, like, as a nation, address the disparities. That's, you know, that's really even a greater moral failing.
No, absolutely. And, you know, I appreciate our, I don't know if you got a chance to see the town hall that our public advocate, Jumaane Williams, and our Brooklyn Borough President, Eric Adams, did with leaders of color around the country, you know, where they said, so by the way, we've always known via our mapping which communities were most at risk, you know? So by definition, if anything, whether it's a storm, a pandemic, you know, or a firefight like comes into this area, if we were doing the right thing, we would head to those areas first to invest in, you know, equitable treatment. So I love kind of thinking about equity and justice versus disparities, because I think disparities kind of lets people off the hook for the actual redlining, all the stuff that actually put folks in these conditions, you know? So,
These are decisions that were made, and they
all
can
decisions.
be, then we can make other decisions. So it's not like this is some genetic thing or some, you know, it happens up in the cloud, something. Like, these are based on decisions. And so you can make, you know, it's an opportunity to make better decisions. And I think honestly that that the societies that make better decisions like this, coming out of this pandemic, are gonna do better. You know, just making this much more of a two-tiered system is going to be a structural vulnerability that's going to have profound negative health implications.
I love, like, that's been like my favorite conversation with folks. Like, so if we know this came from decisions, that means we can make different decisions, right? Like, so I love that you said that, because that prompts us to our next thing. So based on that, you know, what is the future? A different future is possible, right? A future is possible. That's dope. So I know in the future that I want to see, you know, I would love to see, you know, almost kind of a, you know, reparations framework, right? Where, you know, we look at all of this injustice that's been done, which has led to these numbers that are so out of proportion for Black, Indigenous, people of color, Latino, LGBTQ plus, and, like, you know, invest first, listen first, you know, go straight there with all the social determinants, all the food, the appreciating the brilliance, the resilience, the ideas, that we start there. Because, you know, right now, with all of those disconnects and all of those, you know, unjust decisions that have been made, we can start by making decisions that center folks' worth and wellness and move towards liberation and happiness. Because the future I see is not just one where, like, we're able to, like, find out where the disparities are quicker. It's one where, like, you know, kids are joyfully walking down the street and don't have to think about whether or not, like, all these things, all these other things that, you know, are just driving people that I'm taking care of in the community and around the world nuts, that, like, are just way too much of the calculation on whether I should live or die. like the future that I love and see is that like you're literally free in your body, in your home, in your neighborhood to just be. And our system is set up to catch that and pour into that, you know? What do you want to see?
You know, I'll start the question about the future with the past,
Mm-hmm.
which is that in moments of, in moments where, your true self comes out as a country, you make decisions
Mm-hmm.
that are exactly these kind of decisions. And I'll give one example. The United Kingdom during the Second World War, they were obviously getting bombed, attacked, starved off, isolated. And the government made a decision that what they were going to do was make access to food equitable, so that people didn't really have to worry about starving. Everybody was going to get whatever they had, they were going to divide it. And they also completely, in 1941, 1942, democratized access to healthcare, so everybody could get free healthcare during the siege and the bombardment and all these factors. And what they found was that between 1941 and 1946, life expectancy rose in the United Kingdom for everybody, because what they did was they created an equitable, fair system where people didn't have to spend, they had to spend a lot of energy thinking like, how am I going to not get bombed? But what they did is they said, here's a fair and just system. And not only did that help the UK during the war, it laid the foundation for basically a universal healthcare system that persists, that continues to this day. And so in a way, this short-term decision about equity had fantastic short, medium, and long-term implications. And I think really that's what we need right now, is to not just see the health disparities as just an us versus them, zero-sum formulation thing, which I know is antithetical to the ways Americans think a lot of times about race. Just to see that we need a massive effort to rebuild structures and infrastructures in a way that is good for the long-term benefit of our country. And so all the work that I've been doing, kind of keeping this framework in mind, has been through a framework called structural competency. Kind of an idea that in order to really help everyone, and particularly communities of color, we need to rebuild different kinds of structures and also reimagine kinds of structures. And a few examples of the kinds of things I've been writing about. One is that I think that we need a Truth and Reconciliation Commission about what really happened, the real data, the real facts, really look very hard at the structures that made people vulnerable. People themselves are not vulnerable. The structures make people vulnerable. So look at the structures. Second part is then reimagine what healthcare clinics do, just to provide treatment for the sick. Instead, reimagine healthcare clinics as structurally competent clinics that also provide food and financial advice and help you pay your heating bill and make sure you have internet access if you're going to be doing telemedicine and all these kind of things. So in other words, address structural inequities through the framework of health by reimagining what healthcare clinics do and what their engagement with the clinic is, and get buy-in from businesses and public-private partnerships, all these kind of things. I think the third thing we need to do going forward is to democratize information in a way to create healthy messaging that is really created in conversation between experts and the community. And the last part, of course, is that what we're seeing is that health is political, right? That there's politics to health and healthcare. It's not just neutral. So we also need political advocacy in the name of health and disparity. So those are the kind of things that I've been doing under this structural competency framework to try to imagine how can we learn from this horrible time and then build something better coming out of it.
Cool. Yeah, it's as we get into kind of like where we're going next, what activists can learn from futurists and vice versa. I wanted to, challenge or reframe this kind of experts, v community thing versus experts in the community. So like, some of the ways that, we're working structurally in Bed-Stuy right now, understanding very early that like the hospitals with the most vents were very far away. Even the super ship with all the beds was very far away, that everything was far. Was that, we, kind of as a community looked at our wellness centers, our healers, our artists that are here, and started figuring out ways to like, take care of each other, whether it was with, ancestral, herbal techniques, like all of the different things, which I'm trained in as well. Like I'm trained in Western medicine and I'm a yoga teacher, right? So like I like have built relationship, and we are working on building an ecosystem that's really not much different than like the successful ecosystems that exist in Cuba and other countries. I mean, I was just there in February looking at how in every area we recognize, they recognize the artists, the farmers, all of those folks that are experts. And if we consider that expertise in resilience in the community, then that should be poured into and considered part of the infrastructure of the future. And I think we're doing that and working to do that in Bed-Stuy and in Brooklyn, and actually in many neighborhoods around around our country. But Brooklyn, right? Repping Brooklyn. So yeah, so on this kind of like, so to me that actually feeds to what activists can and futurists, like how there can be a, how they can learn from each other, because I consider myself like a little bit of both, like dibbling in all the things. It might be my sociology, my artist, my look, all these different things that I just love to dibble dabble in the world. I'm a dancer, but like even, with a lot of futurists that I've worked with, like there's a thing about art and culture, there's a thing about reading the wind. You know what I'm saying? And I feel like activists, my activist side, like those are my kind of folks on the streets in the neighborhood who listen really, really well. And sometimes there's a disconnect between, if folks are kind of looking at historical trends, but are missing kind of the moment, And I feel like if they're like in the best, like to take from like, Black Panther, right? So Black Panther, Ryan Coogler, talked about how he was building like a lot of his set to think about, the intersection between tradition and innovation, what's been working forever and ever and ever and where we need to go. Like, I feel like that could be like the perfect marriage, right? Between the activist that's feeling the wind and the thing that they heard and felt and smelt and, has them crying, and where people are ready to move, and, the trends and the, those are my general thoughts. What do you think about like the activists learning from the futurists and vice versa?
Well, it's funny, but I'm thinking about the pandemic and Black Panther in line with what you were saying, right? And the beautiful thing about the sets of Black Panther is here's what the rest of the world sees, which is like a bunch of people and a bunch of goats and cows. And here's what's really happening beneath the surface, is like actually something so complicated in advance that you actually can't even understand it, especially if you just look up here. And so like, what are the survival techniques that are happening in minoritized communities right now that are going to be like the long-term legacy of this? It's not like sit around and wait for your Amazon delivery and wait for a vaccine, right? It's like actually like something. So in a way, I feel like there's something really complicated and nuanced happening within communities who are put at risk by this and by social racism, that I think ultimately it's gonna, it's just, I'm totally theorizing right now, but who knows? That could be the way to develop herd immunity. That could be the way to, I mean, there are ways in which, privilege is a risk factor also right now.
Yeah, no, absolutely. I mean, if you think about like the dominant narrative that will take anything that, Black, Indigenous, people of color, Latino, that like, anyone who's been marginalized by, white supremacy culture, that says that they are not competent, that we are not competent, and disrupt that with this, well, wait, maybe if you not only survive, but have some evidence of thriving and having joy, for 400 years, then we should be honoring that strategy. And so what is it from the essential workers? You know what I mean? That's like, how is it that, what is the thing that's in your cabinet that are the breathing and meditation techniques that have, if anything shifts with your breath or with your cells or with your temperature before you have to get the documentation from a doctor, that you tend to in a way that has you so early on the prevention end that it can fight any pandemic that comes your way, so that kind of thing, I think is really, really critical to building a future, and are the tools which, if honored and shared, can be really helpful for the activist futurist.
And you know what I mean? I can understand that,
Uh-huh.
you know, futurism is hard to think about when like the immediate is so hard, right? You know what I mean? Like you're living moment by moment, day by day right now. So, but yeah, no, I think,
I don't know.
you know, the future's what we got.
I don't know though. Like I think about, like I was on this call with like these amazing Black women political folks the other day, and it's like we've always known the aunties and the grandmas that like, you know, had, you know, were figuring out how to do dinner with $5, but then also had a plan for their kids to go to college, you know, or to move, you know, above the Mason-Dixon line or whatever. So I think imagination and creativity, especially if we bring in our art and the folks who are really creating like whole new universes, you know, like that's, the possibilities are there. And I think, you know, it's sometimes the only thing that actually keeps you going. Like, you know, you look at civil rights folks and interview them, it's not, you know, it's the day to day, but it's the what's better for the generations ahead of them.
100% agree with that.
So,
you know, in a way, like the structural things are the easy things, right? In other words, of course, we need universal health care. We need better pandemic preparedness. You know, we certainly need much more public funding for healthcare. All those kind of things are vital, right? But that's the beginning of the conversation.
it is.
You know, the real thing is like, you know, we have a medical emergency right now, and we also have a social and political emergency. And so it's kind of like, how do you use those universal platforms as a way to address the real problem, which is, you know, racial capitalism and structural inequity.
Right.
And it's funny, but I'm not saying this as a way to like push anybody into being like the frustrating thing for me is like, if you look, for example, at corporations or businesses that have a lot of diversity where a lot of different people are really involved in solving complex problems, those businesses are actually
diversity. Right. That's a whole other shot, right? Go ahead.
Saying that actually making things horizontal actually works for everybody. Think of all the psychological effort we're putting into holding up this idiotic system right now. And so in a way, you know, I think trying to make things more horizontal ultimately is good for everybody.
That's interesting. See, now I got all the graphics in my head, all the equity, equality, you know, the baseball field and all of those things. Because I think, you know, everything potentially works if you address racism, power, and privilege, and everything potentially makes things worse if you don't, right? So,
and the work that I do shows that the system we have now is not working out very well for white people either. So,
facts.
You know, so you know, it's time to rethink things more broadly.
It's a thing. It is definitely a thing. Yeah. Interesting. Good stuff. Yeah, that whole thing about it's not, you know, because I grew up with a lot of, you know, diverse white folks in Southern Illinois, you know, and I think, I can't remember which social scientist did the experiment about would you rather be white or would you rather be, like, you know which one I'm talking about. There's this whole conversation, because I think the bet that a lot of people make is that, like, even if we make all these changes, I'd still rather be, it's still like, okay, let's take policing, for example. Still safer to walk down the street no matter how much money you have in your pocket, what your job situation is, what your COVID test is, whether or not you're wearing a mask, whatever. Me, with all these degrees and as zen as I can be, in more danger walking down the street than, you know what I mean? So there's that piece.
I mean, this
we have to address.
We've had 2 months of terror, but we've also been challenged, right, as a society to, you know, again, every country in the world is dealing with the same problem right now, and I really do believe that the countries that even though I know it looks like the kind of China-U.S. model of uber authoritarianism is good right now, ultimately, I mean, just think about the virus itself, right? If there's virus in any pocket anywhere, everybody's at risk, right? Because we have no immunity. And so it's better to help everybody, because otherwise everybody's still at risk. Not the same risk, but so we've been challenged, and I don't know, I'm hoping we've had a bad 2 months, and hopefully some other good stuff will happen ultimately.
I'm worried, but I think we have an opportunity to shift it,
Yeah.
with intention, if we choose. Yeah, that's interesting. Yeah, I was on calls with some of my global peaks earlier and thinking about how Cuba hasn't reported a death in a week, and Brazil is increasing. Some countries in Africa, on the continent are increasing right now. And then, Italy, China, and us are kind of thinking about second wave, because like we see for various reasons how things are shifting. But yeah, if we have to address, so even in the opportunity, to take what we learned from this first wave, from these first 3 months, and be like, you know what, in truth and reconciliation, truth and reparation, whatever it is, like let's write it right now and be like, yep, racism, capitalism did this. Let's reinvest. You know what I mean? Let's invest and let's listen and let's correct that. I think
And reimagine.
I think there's hope. Yeah.
And
space for reimagining. Absolutely. Yeah.
And hopefully those stories will come out, right? I mean, I they're small stories, but apparently there are Israelis and Palestinians working together in Palestine right now. There are places where people with very historical fault lines are realizing, we better fix this situation. That's not the master narrative in the Middle East by any stretch, but but I also think we're realizing the power of community to address some of this stuff. That it's not
the power of community. Yes. So yes to raising our voices in Brooklyn for the folks who have done the daggone thing and figured it out and are ready to hold our entire system, city, and country accountable so that we don't do this like this again. I don't know. I think that's our conversation. What do you think?
Wonderful. Let's please keep talking.
It's been so good to meet you.
Likewise.
Indeed.